I think psychosis is a term which is often not well understood. Psychosis is when you are feeling or having very unusual and upsetting thoughts or experiences. The thoughts and experiences can be of various types. So you could have unusual thoughts, which is having firm belief that something is wrong with you or someone is doing something to you, whereas other people can see that these are untrue. The second thing could be what we call thought disorder. A young person might feel that they can't make sense of their thoughts are going all over the place. And when this happens, often other people cannot follow what you're trying to say or what you're thinking. Then the third thing is to have unusual experiences, which we also call hallucinations. These can be experiences of seeing things, hearing things, or feeling things when there is nothing there to account for them. For example, hearing voices. So a person might actually feel that someone is talking to them or there is a sound around them, but they can't see anything to account for that. So if any of these or all of these are happening to you, then possibly you might have psychosis. Now, psychosis can present either very quickly, and the young person might feel very frightened when they have all of these experiences, or it might come up very gradually. And when it does come gradually, the other people might see it more than you as a person having the psychotic thoughts. They might see it in your behavior, they might see in how you are acting towards other people, how you're relating to other people. And when psychotic symptoms happen, it might have an impact on the way you do things, on your concentration, on your relationship with other people. These symptoms, when they are present, it can be called a psychotic episode. Psychosis is usually a signal of an underlying illness. This can be when someone has had a very stressful event, which might be losing someone who is very close to you, a friend or a family member. It can happen if you have a severe physical illness, like a severe form of infection. It can also possibly happen if you are using illegal drugs like cannabis. And it can be a symptom of underlying mental illness like schizophrenia or bipolar disorder. So if you're concerned that you might have psychosis, or if your family members feel that you might have psychotic symptoms, you can talk to the nurse in your school, you can talk to your family members, or you can talk to your GP. Often then they would be able to refer you to a service called CAM service, which is Child and Adolescent Mental Health Service, or they can refer you to a service called Early Intervention in Psychosis Service. Once you are referred to these services, they will look at what problems you are presenting with. Usually if someone has psychosis, they need a care plan, which means a plan which has various things like medication, like individual therapy, like family therapy. So the medication is a key part of that plan. The medicines we usually advise for someone who has psychosis are called antipsychotics. They would also explain to you all the side effects of the medicine, how these side effects should be monitored, and if these side effects happen, how you can manage them. Often young people ask me, would this medicine change my personality? Would I be ever able to come off the medication? These medicines are not meant to change your personality. These medicines are meant to reduce distressing problems or experiences that you are having. Then you should be able to develop your personality. The second thing is therapy, that will be talking therapies. So you could talk to a trained clinician and they would be able to explain to you the symptoms that you are presenting with. They can give you more information on why you are feeling the way you are, and they could also help you with managing these symptoms. I think when you have psychosis, the long-term effect of it depends a lot on why you had a psychotic episode. With schizophrenia, with bipolar disorder, there is a possibility of long-term psychotic symptoms, but they can be managed. Just like any long-term illness, if we take a physical illness, let's say like diabetes, people have diabetes, they take medication for it, they have a good control over their diet, and they can manage their life. They can live their life as anyone else does. So it's not an end, it's just the start, and the earlier we treat someone who has psychotic symptoms, the better the chances are of them getting better in the future.